In Santa Clara County, there are 3 trauma centers. 2 of these trauma centers are accredited as Level 1 trauma centers, and 1 is accredited as a Level 2 trauma center. Stanford Medical Center is a Level 1 trauma center located in the north of the county, in the city of Palo Alto. In addition to trauma services, Stanford is one of 2 hospitals that can accept pediatric trauma patients. It also houses its LifeFlight program and aircraft helipad. Santa Clara Valley Medical Center, or VMC, is the second Level 1 trauma center located in the center of the county in the city of San Jose. In addition to trauma services, VMC is one of 2 hospitals that can accept pediatric trauma patients. It is the county's only burn center and has a helipad. San Jose Regional Medical Center is a Level 2 trauma center and is the county's 3rd trauma center, located on the eastern side of the county in the city of San Jose. Regional is not a pediatric trauma center. The EMS system distributes patients to trauma hospitals based upon the location of the scene. This map shows the catchment zones for the 3 trauma hospitals.
Medic 50, you're responding to a 3-vehicle traffic accident on southbound Highway 85 right before the Union off-ramp.
We have a total of 2 patients. One patient has an open femur fracture. The other patient was struck in the neck by his steering wheel. He has a traumatic trachea injury and his airway is insecure. The vehicles were traveling 70 miles per hour at the time of impact. Of the 4 hospitals that are in the general area, which hospital would the first patient with the femur fracture be transported to? A. Good Samaritan. B. Valley Medical Center. C. Regional Medical Center. D. El Camino Hospital of Los Gatos. The correct answer is Valley Medical Center. The patient meets trauma criteria based upon the mechanism of injury, as the vehicle was traveling 70 miles per hour at the time of impact. Of the 4 hospitals that are in the general area, which hospital would the patient with the traumatic trachea injury be transported to? A. Good Samaritan. B. Valley Medical Center. C. Regional Medical Center. D. El Camino Hospital of Los Gatos. The patient's airway is unable to be secured due to the traumatic injury sustained. This patient meets in extremis criteria and should be transported to the closest hospital. In this case, Good Samaritan Hospital would be the closest. In Santa Clara County, there are 8 STEMI centers. STEMI stands for ST elevation myocardial infarction. Any patient that meets STEMI criteria or has a return of spontaneous circulation, or ROSC, after a cardiac arrest, shall be transported to the closest accepting STEMI center. Which of the hospitals listed below is not an accredited STEMI center in Santa Clara County? A. Good Samaritan. B. Valley Medical Center. C. Regional Medical Center. D. El Camino Hospital of Los Gatos. El Camino Hospital of Los Gatos is not an accredited STEMI center. Primary stroke centers. In Santa Clara County, there are 10 primary stroke centers. Of the 10 stroke centers, 4 are comprehensive stroke centers: Stanford Hospital, El Camino Hospital of Mountain View, Regional Medical Center, and Good Samaritan Hospital. A patient suffering from stroke symptoms will be transported to the closest appropriate primary or comprehensive stroke center based upon the paramedic's GFAST assessment. For further directions on the GFAST stroke assessment, please refer to the Santa Clara County Protocol 700-A13.